Hello, everyone. Hello, everyone, and welcome to our today's session. I'm Esther Langat. I'd like to introduce our today's facilitators, that is Dr. Wilkins, Patricia, Edith, and Jalagat Kimayo. Welcome. We'd love to hear from you. For those joining, there is a Q&A session after the session, and feel free to text your questions on the chat box. We shall respond. Our first facilitator will be Dr. Wilkins. Welcome, Dr. Welcome, Dr. Kindly unmute your mic.
Thank you very much for this opportunity. Yeah, we are happy to be here today and just take us through a few things about suicide. I know we've had sessions on suicide in other episodes, and I hope today's discussion will be productive. Yeah, so I will go direct to what I was to take us through, but maybe before then, I would just do a brief introduction of who I am, and I will share my screen so that as I talk, I can talk through my slides as we proceed. Yeah, so thank you. Just a minute, I get into start sharing. And in our practice, we realize suicide has been considered as a public health concern, and actually within social work, whether it's in public health generally, in medical social work or general social work, we cannot run away from suicide discussions around suicide and maybe just intervening around this because it's a social issue. Yeah, so I was generally to talk about the types and the etiology or causes of suicide. My name is Dr. Wilkins Ndege Muhingi. I'm a psychiatric social worker. I teach at Pan African Christian University in the Department of Community Development, which is housed within the School of Humanities and Social Sciences. Yes, so I'm happy to talk about this subject. So maybe just going direct into the types, but I know before then we have other speakers, but before even I talk about the types, I think it would be important to talk about what suicide is, not just to assume. I know we may have some ideas or information about what suicide is. Generally, suicide is just cutting short someone's life. In most cases, it's intentionally. So I don't want to make it so theoretical. Yeah, I think that is the layman's way of expressing it. Yeah, so when someone cuts short their life intentionally, or maybe because of one or two reasons, then that in itself is suicide. Sometimes it doesn't really necessarily get into suicide. Sometimes people just think about it. It can be a thought, and then it doesn't get into the action. But when it gets to the action, someone ends up killing themselves. So it can be an attempt and end up into one killing themselves, or it could just be a thought and it disappears somewhere. Yeah, so quickly I'll talk about suicide types, but maybe I want to approach it from the methods that people use to commit suicide before I go into the real types. So when we look at the methods that people use to cut short their lives or to engage in suicide, one is hanging, and this one is said to be one of the most common, especially in African setup, in Asia, but generally in many countries, hanging is considered as a method people use, where generally maybe they could take just a rope and tie it somewhere and throw themselves after tying it maybe around their necks, and then they cut short their lives. There is also drug poisoning, which is a method that is also considered, or maybe many people would opt to use. So drug poisoning, any kind of drug people either you use it to cut short their lives because it has a poison, and they either inject it in their body or whichever way they use it, or maybe drinking, it takes their lives. Pesticide poisoning is another one. Yeah, so because you see, we are living in a, especially in Africa, we are largely agricultural, so many people use pesticides. So someone can easily use it because it's locally and easily accessible. And in many other countries that are largely agricultural, this could be an option. Suicide by gun. Some people are given guns for their own protection, but maybe because of the pressures of life and so on, you find they kill themselves. And we've heard of cases, even children, maybe of people who are owning guns, killing themselves when they access them. We've heard of cases of maybe people themselves who have guns, maybe killing themselves using the guns they have, and others maybe in the security, in the forces, based on the different pressures that are pushing them that direction, so they kill themselves, jumping from a height. This is also not something very new. Many people have been said to have jumped from a high place down, maybe with the aim of killing themselves, and it has happened a lot. Drowning is also another option, where maybe there's a mass of water, it could be in a river, it could be whichever body of water, and they just cut short their lives. And also self-immolation. Yeah, immolation is to do with burning. Yeah, so causing, using fire is another one. And then suicide by electrocution. Yeah, because you see electricity is almost everywhere because of this industrialization that has come up, urbanization. And people are really using that as a method to do it, to commit suicide. Cutting veins. Yeah, there are those who know which vein, when it's cut, they can just bleed and they end up dying. You know, when you bleed too much and the brain is not supplied with oxygen, it doesn't have to take more than 4 minutes for someone to die. So those who utilize that, cutting their veins or one of their veins. Others may decide to stand in front of a train or even a car that is coming, which could also be like the car crash. So just standing in the middle of the road or wherever the train is passing, well, the train on the train, the way of the train, and then the car also on the road. Yeah, so those are just some of the various methods that are used, which to a greater extent could be pointing towards the types. But let me talk about specific types. The types of suicide with regard to causation. So there are many causes. When we think about suicide, there are many people who will be suicidal because they are pushed by certain factors. So they could be social, biological, they could be psychological in nature. So there have been many studies and arguments of the fact that people cut short of their lives by suicide, and this could be because it's something that is in the family. So there is growing recognition that suicide and suicidal behavior are familial, and the family or familial transmission of suicide behavior is not very easy to explain, but truly that happens. And there are many studies about, there are people who have carried out studies on twins and maybe those people who are adopted, whether they have been from families that have had cases of suicide, and just checking and seeing whether there are high chances that people who are from suicidal families would end up committing suicide, or just comparing the two, having control groups of the same. Yeah, so suicide is said to be caused because of that, or coming as a result of that. It could be running in the family, which to a greater extent could be associated with what others would consider environmental or maybe the social factors around, but these ones are tied to family. And others also even relate this with the maybe genetics or inheriting some genes, but it's not very clear. But the bottom line is a familial cause is there to explain why suicide happens. Yeah, so environmental causes are also there. I would like to associate these more with societal cause. The environment where people interact with one another, the environment, the society by itself can push someone to that direction. So there are types of suicide created according to someone, a sociologist called Emile Durkheim, who is a functionalist, who suggested that suicide was more or likely to occur due to the to levels of regulation by society and even levels of integration. What basically this means is depending on how the society is, how much it is regulated or to what extent it is regulated, and then the levels of integration, how much the society is integrated, meaning coming together and that kind of thing. So this is Emile Durkheim's thinking from a sociological point of view. So Durkheim's conceptualization or understanding or helping us to understand suicide and even the many other studies that have come later, because Emile Durkheim lived earlier in the 19th century. Yeah, so there are other newer studies, 2005, 2014 onwards, that have examined and tried to look at suicide relating to Emile Durkheim's thinking. So the newer studies are focusing on something they call social capital. So what is this? Social capital is defined as those connections you see in the society, how people are connected, individuals, groups. So those social networks, the norms they share, and so on. So social and networks and norms of reciprocity and even trustworthiness that arise from them, in a sense of social capital, is closely related to what some have called what civil virtue. So social capital is discussed nowadays as maybe an equivalent of what Emile Durkheim was looking at as regulation and integration, as I have earlier mentioned. Yeah, so we will look at specifically those typologies according to Emile Durkheim. So Emile Durkheim or Durkheim talks about 4 types of suicide. Egoistic, because of selfishness, ego is to do with self. So egoistic suicide occurs when an individual does not feel as if they are well integrated in society. And we see as social workers, we are dealing with people, we are dealing with families, we are dealing with groups. And it would be interesting for us to just see how integrated different parts or structures within the society are. So if someone does not feel they are part of it, it concerns us. And yeah, you might find that there are people who feel out of place, maybe because of racism, ethnicity, but at a family level, there could be someone, some people may call the black sheep, or someone who just feels, no, I'm not in the right place. And they can easily commit that kind of suicide because their focus is on self so much and they are not so much integrated into the society. As I said, Emile Durkheim looks at integration and levels of regulation. Yeah, so fatalistic is another one. It's suicide that occurs when regulation in the society is excessive. There's too much pressure and you have to do this, don't do that, do this. In a family setup, in an institutional setup, like in a school, we've heard of cases in schools, in colleges and institutions of higher learning. When there's too much regulation, that doesn't mean regulation should not be there, but truly it happens. And we know social workers practice within institutions like schools, social workers practice in facilities like hospitals, they practice within communities. So when there's too much of this regulation, it could even be, sometimes we've heard of cases, police brutality and such. So a lot of pressure from that angle can cause this kind of suicide. It may not be the only one, but truly we can look at it like that. Then altruistic suicide, those from a Christian background would look at this and equate it to the dying of Jesus Christ. You die on behalf of. So there's an individual who is too integrated, too much connected into the society. According to Emile Durkheim, is that his suggestion is that when an individual is too integrated, the pressure to succeed for greater good could be overwhelming. We've heard of cases of even bombing, people bombing themselves or dying on behalf of others. Someone could die because of their friend, someone who they love so much, or their family or their community, and they can decide to give away their lives, specifically just to because of this reason, because they have given themselves so much or too much to even die for the family, the society or the family. Yeah. So altruism. And then anomie is to do with the normlessness, or maybe issues to do with the regulation and so on. Yeah. So anomic suicide is likely to occur when regulation of society is disrupted. There is no much order, or maybe disruption occurring when it comes to regulation. So an act of, actually anomie means normlessness in French. Middelhem was a French person. Yeah. So then the psychological explanation. Yeah. It's not yet captured within DSM-5 properly. DSM-5 is statistical, we call it the diagnostic statistical manual. There are different versions of this manual. We have 1, 2, 3, 4, and the latest is 5, the 2013 version, which is used maybe just to help us as we do diagnosis, or maybe just to categorize and classify psychiatric disorders or mental disorders. So if you look at the latest DSM-5, there is just that consideration or a recommendation for further consideration to ensure that this one is included, which is still, of course, there's a lot of research going on for this diagnostic statistical manual to come out. There's a lot of research that goes into it so that they categorize these mental disorders into different categories. So suicide, for it to appear there through research, later on, it might appear in the coming versions or editions, because the latest is as I said, DSM-5. So the suggestion is it should be called suicide behavior disorder. So if it is included after a lot of research, then maybe we would get more information on this. But truly, from a psychological point of view, because of hopelessness and such things, suicide can occur. But if you look at the previous versions of DSM, or the diagnostic statistical manual, you realize that in the earlier versions, this suicidal behavior was considered more as a symptom of depression. And there are different kinds of depressions. These are categorized under mood disorders. So there is what we call major depressive disorder, and then borderline personality disorder. These are some of the disorders that could come, or suicide could fall under that as a symptom, that someone who is depressed, they may be suicidal, they may think of, they may have that ideation. They feel like, no, I am not important. I'd rather die. I'd rather take my life, such things. So there are those possible consequences of other psychiatric disorders, diagnosis, sorry. Yeah, so I think I'm through. Maybe just to conclude that what I've just been talking about is that there are substantial differences when it comes to the methods that are used to engage in suicide, or to even to take someone's life. In the world, they are different, and they are used differently in different countries. They may adopt more of this than the other, based on the category, the examples I gave you, the list. And then again, today, the frequency of suicide is increasing. And this is a reality, not just in many countries, but even here in Kenya, in Africa, where we are. Yeah, many countries struggling with this, and we are getting a lot of these problems or challenges. So in most countries, most popular methods of suicide are poisoning and hanging, as I said, like in our case, maybe in Kenya, in African countries. But those are not the only ones, but these are the main ones that you'll hear so-and-so took a poison or hanged themselves. if you're comparing in terms of the prevalence. Yeah, so poisoning is more popular among women. So men are more into suicide, or they may easily even get to the act of committing suicide. Women may think about it, may attempt, but may not necessarily finish up to the end of it. Statistically, if you compare in terms of numbers, so poisoning is more popular in women. Men use more violent ways, like hanging, because for them, men are aggressive, or they are that. It's believed even from a cultural point of view, so they may use those more. Women may fear or may feel they will want maybe softer ones or silent ways. Yeah, and then suicide attempts are unsuccessful 20 times more frequently than attempts that end. So those that do not succeed are more. They are 20 times more frequent than those that will succeed, or it ends up being death, or this person ends up dying. So women as a group are more frequently attempt suicide rather than committing it. Men, is the opposite. Yeah, and I think this is all that I have for today for you. Thank you very much. And good evening.
Thank you so much. Thank you so much, Daktari. Thank you so much. I'm going to welcome Patricia so that she can take us through the ways of recognizing and managing the population that is at risk of committing suicide. Welcome, Patricia.
My name is Patricia. I'm a social worker as well as a psychological counselor. I work in a hospital in Kisii, and I'm so happy that today we've decided to discuss issues about suicide. It is because that is what is happening nowadays, and more so from where I work, I have a lot of issues, and let's say a lot of examples that I can give, because there have been so many people who always come here that they've taken medicine, they've taken poison, because that is the most one that people are doing. They take poison, that is from triatics, they take even acid, they take even the ones that we use in spraying plants. So I'm going to talk about the signs, the warning signs that someone needs to check before, or when you want to identify someone who is about to commit suicide, or someone who is intending to commit suicide. One, we have the severe sadness or moodiness, which lasts long, or when someone is in some mood swings or unexpected rage. Something small makes that person to be angry, and that one is one sign of someone who is likely to commit suicide. We also have hopelessness. Some people feel that they are alone in this world. And more so, I've come to realize that for some kids, maybe for those who've tried to attempt suicide here, the ones that feel like their parents have left them, so they think that in this world they are alone, and they intend to take the poison so that they can die because they feel hopeless. There is no one to talk to, there is no one to attend to their needs, and so on and so forth. Another one is sleeping problems. Those people who have, okay, I'm back now. So another thing is a lack of sleep, because when someone is tormented, they cannot even have a good sleep. So that one is someone, for example, when you see someone who is tossing on bed, moving around, they don't have sleep. So that is someone who is really disturbed, and those are signs or warnings that someone is intending to commit suicide. And then sudden calmness. Sometimes someone goes through a lot, and maybe they've been talking about maybe wanting to commit suicide, or talking about what they're going through. And if they feel like someone is not taking keen heed of whatever they're talking about, then they intend to feel like now, because I don't have to tell anyone whatever I'm going through, then let me just keep quiet. So this sudden, when someone becomes so calm, and that is one thing that maybe this person is depressed. So that is a sign that this person might decide to end their lives. Withdrawal, choosing to be alone, avoiding friends or social activities. When someone wants to be alone, then it means that that someone is also thinking about taking their lives. Because when you're a normal being, of course, you have a social life. But when you don't socialize with other people, and you've withdrawn yourself from friends and even family members, then that is one sign also that someone intends to take their lives. Another one is change in personality or appearance. Sometimes the attitude or the way these people talk, or the unusual way of doing things. This shows that someone is undergoing something, and maybe they might appear, or even being unkempt. Sometimes someone feels like even dressing up or combing their hair, they feel like now there is no need of doing this, because in this world, it seems things are not going well with them. Another thing is self-harmful behavior, such as reckless driving, engaging in unsafe sex, because they have lost hope in life. So they can engage themselves in the reckless lifestyles. Increased use of drugs and alcohol might indicate that the person no longer values their life. So, and if someone does not value their lives, then of course they might think of taking it. Recent trauma or life crisis, it might trigger a suicide attempt. That include sometimes these people, they go through these attempts because maybe due to loss of loved one, or even a relationship that they really loved this person, and maybe that relationship ends. So they feel like then they no longer have anything to value in this life. So they think that taking their lives is a solution. Another thing is loss of job or serious financial problems. And maybe when someone is in debt and now they've lost their jobs, they no longer have any financial income. So they feel like now there is no meaning of life. Another one is making preparations. Some people begin to make preparations before they take their lives. One, they might even write wills. Another one, they might even put their house in order. They can even clean their houses. They share out their possessions. So these people, when they start doing this, then it needs someone to identify these signs so that they can be helped if there is any help. Because, suicide, suicide is not a mental illness, but it is treatable. When that person is identified early and taken to a psychologist or a counselor who can handle that. And then threatening or talking about suicide, 50% to 75%, those considering suicide will give someone, a friend or a relative, a warning sign. It may not be an outright threat. They may talk an unusual amount about death or say things like, I would be better if I wasn't here. However, not everyone who is considering suicide will say so. And not everyone who threatens suicide will follow through it. So every threat of suicide should be taken seriously. And then sometimes we have people that we rate them that this person is mostly likely to take suicide. So those people who've been around, the people who've lost, all people who have lost spouse through death or divorce, we have people who have attempted suicide in the past, because sometimes it repeats itself. So when these people who have attempted suicide, then someone needs to be closer to them, because sometimes they might be tempted again to take their lives, and maybe this time around they'll not be saved, and they might even die. And then a family with a history of suicide. We also have a friend or co-worker who have killed themselves. We have history of physical, emotional, or sexual abuse. Sometimes people who've gone through sexual abuse, it is something that people feel that we cannot talk about it. Something like sexual abuse. When someone has been raped, they feel like if I talk about it, someone might judge me. So sometimes they don't talk about it, but later on it will torment them time and again, and maybe it will reach a time that they decide they want to take away their lives. And then we have people who are physically challenged. They might decide to take away their lives because maybe the way the society treats them. And then the unmarried, unskilled, or unemployed, we have long-term pain or a disability or terminal illness. You have several terminal illnesses. For instance, we have people who've been diagnosed with cancer, who've been diagnosed with HIV. We have those who've been diagnosed with several illnesses, terminal illnesses. So sometimes they feel like I'll be making my family to go through some pain by, let's say, for instance, a cancer patient. Cancer really needs a lot of resources for someone to undergo treatment. So when one is undergoing such a trouble in their lives, they feel like then there is no need of me being here. And another thing is those people who are prone to violent or impulsive behavior. We have recently been released from our psychiatric hospitalization. Those people have been in psychiatric hospitals. Sometimes they would still want to go through to commit suicide. People in certain professions, such as police officers, police officers, they undergo a lot. And they really need people to be closer to them. Because you've even heard from the news that police officers are committing suicide. Why are they doing this? It is because of what they go through. Sometimes for those people who are taken for peacekeeping, let's say in Somalia, when they are there, they shoot to kill because they are dealing with enemies. So when they go through this, it will be in their minds. So though I was told that these police officers, sometimes when they come out after the peacekeeping, they always undergo psychological counseling. But I'm not sure if they get really fully treated, because they come maybe after 1 year, they go back. After 1 year, they go back. So this thing will keep tormenting them and they'll not feel like there is worth living. And then we have those healthcare workers that we've attended to patients who are really down and they have these terminal illnesses. Sometimes we feel like life really does not have a meaning. And then we've said, although women are 3 times as likely to attempt suicide, men are far more likely to complete the act. Women sometimes, they think like, now whatever I'm going through, maybe like single mothers, they feel like the burden is on them. So sometimes they contemplate suicide. But it will reach a time when they see their kids, they feel like, no, these kids need me. So if the kids need us, then we feel, no, then let us just keep trying. But for a man, when they've decided, then it is a one thing and they do it. So can suicide be prevented? Suicide can't be prevented with certain, but risks can often be reduced with timely intervention. Research suggests that the best way to prevent suicide is to know the risk factors, be alert to the signs of depression and other mental disorders, recognize the warning signs of suicide and intervene before the person can complete the process of self-destruction. As we've said, suicide is not a mental illness, but it is a treatable, mental disorder. So if we see anyone with these signs, then it is for us to get closer to them to see if we can help them. And then what should I do if I think someone is suicidal? People who receive support from caring friends and family and who have access to mental health services are less likely to act on their suicide impulses than are those who are socially isolated. If someone you know is exhibiting warning signs of suicide, then don't be afraid to ask if they are depressed or think about suicide. Ask if they are seeing it. Then you can ask, sorry about that. You can ask them if they are seeing a therapist or taking medication. Then rather than trying to talk the person out of suicide, then let them know that depression is temporary and treatable. In some cases, the person just needs to know that someone cares and is looking for the chance to talk about their feelings. You can then encourage the person to seek professional help. So it is not good to always talk the person out of committing suicide, but we get to see because we've already seen the signs, then we get to think on a way to help them by asking them if they need help, by asking them if they are in any medication, or if whatever they are going through, are they ready to talk about it? Because, a problem shared is a problem half solved. So whenever they share about the issues, then they can get help easily. And then another thing is, what should I do if I see the warning signs of suicide? If you believe someone is in immediate danger of killing themselves, do not leave the person alone. If possible, ask for help from the friends or other family members. Sometimes, in counseling, we have what we call confidentiality. But sometimes when we know somebody's life is in danger, then we have to breach the confidentiality by doing what we call shared confidentiality. That is by doing it with close friends or family members. And then we ask the person to give you any weapons they might be having, or take them away, or remove sharp objects or anything else that the person could use to hurt themselves. If the person is already in psychiatric treatment, help them to contact the doctor or the therapist for guidance and help. Try to keep the person as calm as possible. We also have a number that someone can call for emergency, that is 911. You call the local suicide prevention hotline or the Substance Abuse and Mental Health National Suicide Prevention Hotline. There is a number there that someone can call if there is need. And then how can we manage? How to manage suicide? We have one, compassion. It is really a key in helping someone to recover from any illness, whether it is encouraging them to do something that might help them cope with their illness, like seeking out appropriate treatment or offering to do something they are struggling with, even if it is just washing up the dishes. Sometimes we might see some other tasks and we feel like, so this one can even make someone commit suicide. No. We don't really need to judge people by looking at something that might look simple to us, but it can be hard on them. Another thing is, you should encourage them gentle to talk about their feelings, or make them aware that you totally understand if if they don't want to talk about it, but we reassure them that their situation is going to be better. We need to understand them in whatever difficult situation they are going through. We need to understand them. We should not be a psychologist if you know that you are not trained on that, because sometimes we try to talk about something and someone tells you, are you a psychologist? So if you know you are not a psychologist, then don't try by giving advice beyond the knowledge that you have. Another thing is having patience with them. Be patient with those people, because whatever they are going through is really tormenting them. So we should not add to whatever pain they're going through. Spend time with them. Some people who are depressed, they really need people to be close to them. So up to there, thank you.
Jelagat, are you there?
Good evening, everyone.
Good evening.
Yeah, my time has really gone. I'm having a meeting in the next 3 minutes, and I don't know how I'm going to present this, but I'll just give just 3 points, then we end there, then we can plan for more time. So our role as the social workers with prevention of suicide, one of them is I'll talk about the economical aspect. How do we empower our clients in terms of financial sustainability? How do we bring them to strengthen the economic supports? One of them is strengthening the household financial security. The second one is housing stabilization policies, like we lead in terms of the policy making. And before even leading in terms of policy making, we can even try and place our clients in a safe space, like safe housing, probably the transitional homes, and even placing them in we've seen children being placed in the children's homes. How do we place these people in a safe spaces so that they can just stay there for some time and ponder for some time and even think. Number 3 is introducing the chamas. I think in our community, we know more of chamas and table banking. This way, we can bring in our resources together. At the same time, we ask ourselves and we bring in the togetherness that someone may not think astray or have thoughts of suicidal ideations. The second one is strengthening the access to delivery of suicide care. Do we have places where we can refer our clients in the hospitals apart from the psychiatric units? Do we have the psychologists? Like, do we have the hotline numbers? How do we refer our clients to this personnel? How do we get to understand that you don't have to go to a psychologist when you're having problems, but anytime you can visit a psychologist to have a talk with them to probably sensitize you on some few things. Another one is coverage of mental health insurances. How do we emphasize the use of NHIF so that whenever someone goes to the hospital, we reduce the burden of hospital payment? How do we support them as social workers to enhance them have the NHIF so that this can lessen the burden? Number three is reducing the provider shortages in the undeserved areas. This we can do it by mentorship. As Mercy, how can I support a social worker in Bungoma, a social worker in Webuye to help them handle the suicidal cases? How do we mentor ourselves as the social workers, especially the senior social workers? How do we mentor other people? The third one is creating productive environments. I think I've had Dr. talking about the environment, and I'm not going to repeat that. The next one is promote connectedness. Having the peer groups in our communities, having the programs, like for instance, even games like playing football together can bring in the togetherness and connecting each other to the community. The next one is community engagement activities. How do we participate in the community activities, like even the barasas, the chiefs meeting, and such things? And other things that we can engage them is placing our clients to this kazi mtaani. How do we, through the barasas, identify these people and place them to even the kazi za mtaani? Another one is about teaching them coping and problem solving skills. And one of them is social emotional learning programs. One of them is the techniques like cognitive behavioral therapy and motivational interviewing. The second one is the parenting skills. How do we support the parenting and family relationship skills? Because in our community, someone does a mistake, mama anachapa we kwenda huko. How do we support the parents to talk to their children in a nice way, to encourage their children and bring them closer to them so that whenever there's a problem, this child can reach out to the parent and like doing something or even attempting suicide. Another one is identifying the and support people at risk. Who are the people at risk? For instance, those who have been sick, how do we support them? For instance, the people who have had like one time try to attempt suicide, how do we support them? So we, for instance, the treatments, we give treatments and even treatment to prevent the re-attempts. An interruption, but that is okay. The next one is lessening harms and prevent future risk. How do we keep the things that these clients can use to harm themselves? How do you safeguard them? And then I think that's all from me. Thank you so much. And I'm so sorry that I had to make it quick. I have a meeting that I'm attending. Thank you.
Thank you so much, Delegate, for the presentation. Doctor, do you have any conclusion before we welcome Diana, our NASW Rift Valley chairperson? Daktari.
Yes, I'm here. I didn't hear you get what you said.
I said, do you have anything to add to conclude before we welcome our chairperson for Rift Valley, Diana?
No, I don't think I have anything to add. I like the very practical examples that have been given from the two previous speakers on what really is happening and what the role of social workers can be or are in dealing with just managing the cases and also identifying. Yeah, those are very practical things which can work and which have worked. So when we hear them from someone who has practiced, and we know that they are very practical. Thank you.
Okay, thank you so much, Daktari. Diana, our chairperson, Rift Valley NSW. Do you have something to say?
Yes. Good afternoon, Esther and everyone.
Good afternoon
Good
to
evening.
Diana. Good evening to.
Sorry, good evening. Yes, my name is Diana. I hope you can see me. My name is Diana Komen. Yes, I'm a social worker by training, a social worker also by profession, being a children officer, and currently the chairperson in charge of Rift Valley region. First and foremost, I want to appreciate the team that organized for this session and discussions on this area of suicide, which many of us and many social workers may not be aware on what to do and steps to take when they come across such cases. So thank you so much, Mr. Mayaka, Madam Esther Langat, and everyone else who participated in coming up with this discussion. Unfortunately, most of social workers did not manage to join the session. Simply, it could be they were not aware or we didn't have time to mobilize, because we have so many social workers, and I could see that in the discussion, in the meeting, the participants were less than 15, which means we didn't actually meet the threshold of participants to warrant the discussions. However, we have learned something. We won't regret, though we were few, but at least the few of us were able to understand that in case what suicide means, types of suicide, in case there are signs, we should be able to see and act appropriately. I want to appreciate our panelists who have taken us through, Dr. Wilkins Muingi, Madam Kimayo Jelagat, Madam Edith. Though I joined the meeting late, I don't know if Edith had already presented. Then last but not least, Madam Patricia. The presentation was very informative. And I want to believe that going forward, we should be able to have more discussions. Oh yes, I'm told there were other participants or presenters, and I believe they have been following. Sorry for that. And it has been very, very informative. And going forward as social workers, I want to believe that when we come across such cases, we should be able to address them adequately. Sorry? Pardon? Okay. So I was not able to join you early enough because I was engaged in some other trainings. But for the short time that I was in, I could seriously understand that we have a challenge when it comes to addressing issues of suicide among, especially for us who are working with teens and children. It has not been very, very easy to advise even the parents and caregivers who are taking care of these teens and children, youth that have suicidal signs and attempts. So I want to appreciate everyone who has given us some information, background. I've seen a lot of information from Dr. Wilkins that when we come across these cases, we should be able to handle them and confidently, and we should help someone who was maybe could be planning to attempt to commit suicide, or as some suicidal signs and symptoms. Because I know even for us, maybe you have not handled such cases in your place of work, your family, community, you must have experienced a form of suicide among the four that have been mentioned, and at least we can relate and go back and address those cases if we were not able to. So I want to say thank you so much, but going forward, maybe we should continue having more of such discussions so that social workers are capacity built, and even those psychologists, everyone who is handling social issues in our society should be able to learn about cases of suicide and how to go about them. So I don't have much to say. I just want to say thank you guys. And going forward, we'll work together. Sorry for not joining you early enough. Sorry for not mobilizing the social workers. But in the future, in the near future, I should be able to mobilize my social workers in the region so that they participate. Because I was seeing 13, but someone is telling me others are also in. So asanteni sana na nafikiri tutaonana. Asante. Back to Esther.
Thank you so much, Diana. We started the session a bit late and we're really sorry about that. And we have other platforms. It was live on Facebook at the same time on YouTube. So I suppose other people joined there.
Okay.
Yes.
Asante.
Thank you everyone for your session. Thank you, Daktari. Thank you, Patricia. Thank you, Jelagat. Thank you, Mayaka, for organizing this. I think we should be doing more often of this. And considering next month being a mental health awareness month, I think we should plan for one early and then do mobilization. Yeah.